of the Sinai Hospital of Baltimore. Oh, sorry, you're recording. For Sinai Hospital of Baltimore Pure program. I've been the program director actually since July of 2021. So I'm kind of the new kid on the block in a sense. I did my residency as well at Sinai, so a little bit inbred. I did do a fellowship in spinal cord injury medicine at UPMC, and then I came on board as an attending in 2016. I do mostly outpatient neuro rehab, seeing a lot of stroke, TBI, spinal cord, spasticity, the whole gamut. Work with residents and med students as well. And the medical director for our outpatient TBI program called the Return Program. And yeah, thank you for inviting me.
Yes, thank you and welcome to all the panelists. We are so grateful to have you here tonight with us. All right, let's just jump right into those questions that you guys were so great about submitting. So Dr. Godfrey, can you please share your experience on finding balance between being a mother and prioritizing family while also being a physician and leader?
Okay, so as I was thinking about this question, I thought about how nobody asks men this question, right? And nobody asks men, how do you balance being a father with being a physician? So it's really interesting, even though it should be just as important for our male colleagues as it is for us, right? And I do think culture is changing. I've noticed with our residents in our program, I see our male physicians who are fathers taking some time off for paternity leave, et cetera. But it's a bigger burden on women who become mothers just physically. And so there are some unique challenges. So I think it's a very good question. So just a little bit about me. I have 4 kids. My kids are 7, 10, 13, and 16. And it's a challenge, right? It's a challenge to juggle any career really with motherhood, but there's some unique challenges in medicine. And gosh, looking back, I'm like, how did I juggle that? I don't know. It's not, and it's much easier now that they're older and they're in school. So I'm trying to think what advice I can give. I would say, I remember vividly in when I was applying to medical school, and I was working with just actually a PM&R doc, and she said, make sure that you pick wisely on who you have children with. And I think that's probably really some really good advice. Whoever you are going to be parenting with, your spouse, your partner, you need to make sure that they are going to be in it with you. Because it can be it's a big job to raise kids. And so it's good to have somebody who's a really good partner. And my husband's always been a really good partner for me. And I had my first child in my 4th year of medical school. I interviewed for a residency pregnant. And that gives you a very clear idea of what residency programs are going to be supportive of you when you're visibly pregnant. And so there were some not good experiences with places that I interviewed, but it was nice to know very clearly that was not somewhere I wanted to train. My number 1 choice was the University of Utah. I really wanted to come here, and I'm super glad I did. And it has been a very supportive place to train. And I think finding a place that's going to be supportive of you is really important. And then finding other people who are further along in your career than you to be supportive of you. My current chief of rehab at the VA where I work is a mom as well. And she was right from the beginning when I very first started residency, she sort of pulled me aside and took me under her wing. And that was really important to me. But men can also be incredible mentors. And there were multiple men that also sort of watched out for me. And I had a baby in residency as well. And when it came time, when I had the baby and I took some time off, and then I came back, and it was right at the time when it was time to start looking for new chief residents for the following year. And I was like, no, I can't do that. I just had a baby. I just came back from maternity leave. And 2 or 3 people pulled me aside and said, I really think you should put your name in to see if you get selected. I think you do a really good job. And some were men and some were women. But having people see potential in me and helping me realize that was really key, because I think I would have counted myself out. So I think that's one of my words of advice is don't count yourself out just because you are a woman or have kids. Make sure that you're not, if other people are going to count you out, that's on them, but don't count yourself out. So
Yeah.
I'll let somebody else weigh in if they'd like to.
Would any other of the panelists like to add more to this topic?
Well, I don't have children, but I do want to remind all the women that just because you are a woman and we do have that societal expectation on us to have a family and have children, that you don't have to if that's not something that you want. And kind of thinking about, I mean, we're all type A personality. We always like to look ahead and plan our next 10, 20 years. So when I was a med student, I was like, okay, well, I'm going to finish residency. Then I'm going to plan on getting married and having a kid. And I never really sat down to actually analyze that to see if that's truly what I wanted. And it wasn't until I became an attending when I really did like sit down and think about that and see if that's truly what I wanted. And I decided that that's not really what I wanted. And I'm very happy with my decision. So yeah, I just want to remind you guys that that is an option too.
Piggyback on that with Miriam's, because I'm also single. I'm not married, and I, don't have children. But this is also basically not just being a mother, but being a daughter. I guess I would say, as a family, I have parents. Parents were, becoming elderly as well, and so taking care of them or trying to make sure that I spend time with them. So my parents are actually overseas, so I had to make sure that I, block times. So it's not necessarily on an everyday basis, but at least I would make sure I would do trips, or they would come to visit me here, or I would go back home. So those are things that, it's not an everyday kind of balancing out, but I have to make sure that I incorporate that in how I am still a daughter, or I am still a sister to my brothers and all that. So I think those are things too that we have to consider, but we can still enjoy our career and also still go into the leadership positions or whichever career path we wanted to take.
Thank you. Yes, what I love most about you guys' answers is that those three very different perspectives, which really I feel like can help apply to all of us. So thank you for that. Okay, we'll go on to our next question. Dr. D, could you please share a story where you felt that being a woman helped you excel in patient care as a physiatrist?
That was I had to think through with this. I don't know if it's being a woman or what. I don't want to also sound biased, against men that, that I would say, for example, a compassionate heart, but I won't say that the men don't, because I think sometimes we do see things differently or approach things differently, but we would still be able to provide the same high quality care, right? It's just a different approach. I think for me, I could, as a physiatrist, and I take care of children, so I'm a pediatric physiatrist. So a lot of the times we end up also becoming kind of the primary, almost like quote unquote medical home, for some of for most of our children with disability, or those who fall under the, rehabilitation world. So recently I had the privilege to take care of a child who had functional neurologic disorder, but had a lot of psychiatric or psychological, also, mental health problems, so to speak. And but we were trying to get her into an aggressive inpatient rehabilitation program versus an intensive outpatient. So I found myself having to pull together, all our multiple, members of the team, from different specialties, psychology, psychiatry, GI, and our physical therapists, occupational therapists, and everybody on the table to try to have all these case conferences and all that. So I as I said, I am not sure if it's being a woman, like in terms of the compassion that you have, that drive to like, hey, come on, everybody, let's sit down on the table, and we can't just not do this. But I wouldn't, as I said, men would do that as well. But I guess with that, sometimes you just think about it. If I was a mother, like, how would this child be? But as I said, again, I'm going to piggyback on, like, not to say that men don't. maybe some of the things that most of women may do is like also not just necessarily in patient care, but kind of juggling through in terms of what we call multitasking, which is maybe most of the time, maybe women may do a lot more better, or like maybe women are a little bit more gifted in this. So I guess it depends on the situation. But as I said, I think it really is, I don't necessarily feel also it's a gender kind of thing, but it really is basically based on whatever compassion part and care that we want to provide for our patients. So, yeah.
Thank you. Okay. Would any of the panelists like to share a story that they have in mind, or?
No, I mean, I completely agree with Dr. D. I think we're just as good as our male counterparts. The only thing I would mention is I think we might be able to establish rapport maybe a little bit better with our other female patients. They might just feel a little bit more comfortable with us than maybe some of our male counterparts. And I work more with the people who have had concussions and brain injuries, and some of the concussion patients I see are due to domestic violence. So they may not feel as comfortable with my male counterparts as they would with me. So I think I can build that trust with them a lot faster. Not to say that my male counterparts can't, but I feel like they might just trust me a little bit faster just because they feel a little bit safer with me as a female.
Mm-hmm. That makes sense. Thank you.
I don't necessarily have anything to add, but I think those were both really great responses, and I just echo them.
Yeah. Thank you. All right, we'll go on to the next question. Dr. Karamati, although PM&R is an incredibly diverse and accepting field, unfortunately, mistreatment exists in medicine regardless of the specialty. What are the challenges you faced as a woman in medicine, and specifically in the field of physiatry? And how did you overcome these obstacles?
That's a really challenging question. I guess the biggest thing I can think of is every time I walk into a patient room, a patient I've never met before, I always have a spiel that I go into. So not only am I a female, I'm young. I look younger than I am. I'm a DO, so sometimes I have to explain that, but thankfully less so now. Very rarely will I have to explain what a DO is. And then I need to explain what physiatry is. So I need to explain just my role in their care. So I kind of enter the patient's room introducing myself as Dr. Karamati, so they know that I'm their doctor and not the nurse or the therapist or some other assistant, that I am the doctor. And that they're here to see me because of X, Y, and Z. And then this is kind of my role in their care. So I try to like nip it in the bud as quickly as I can, so that we can move forward with going through the history and physical, and so I can develop a plan to get on the track to be more functional, more independent. So I'm not sure if that completely answered the question, but yeah.
No, thank you for sharing. That is wonderful to have that's a good idea to have a little spiel ready, especially with physiatry. I know just from talking with my own family, a lot of them are like, they've never heard of that. So I feel like I've kind of had to prepare my own. So that is very relatable. Okay. Any of the other panelists, have any other additional comments?
I'll just add since I see patients at the VA, like 90% of my patients are male. And so that sets up kind of a unique dynamic. And honestly, I haven't experienced a ton of misogyny or sexism, which has been wonderful. But I get this, I have gotten a similar thing where, and I don't look as young as I used to. I've been in practice for 12 years, but I used to look really young. And sometimes my residents were, were older than me, actually. And so I'd have like a male resident who's taller than me and older than me. And the patient really wouldn't get that I was the attending. So I'd have to be very clear about, who I was and who the resident was. And I also really encourage my residents, and especially the female ones, to call themselves Dr. whatever, and to not just say, hi, my name's Anna Jones, I'm the resident. Say I'm Dr. Jones, because I would just get in the habit of doing that, especially as a woman. I think it's really important that we say that, because oftentimes you do get mistaken for the physical therapist or the nurse. So when you get that title, use it.
Yeah, I love that.
One thing I'd like to add is that there's still, when I was in residency, or maybe even maybe now it's existing, it used to be also kind of a male dominated, a residency program, a residency that people go into. So I remember during my time, so probably at 10, I've been in practice 13 years. So most of the times, like in each class, it's basically only 20% or less that are women in the group. And so cumulatively in the program, so you look at, when we look at our class picture for all the 3 years, you could definitely just pick out the women. And so sometimes it feels like, yeah, the guys are having fun, and then the women are not necessarily always included, just because their fun is different, but I think this is where the relationship, basically, it definitely depends also on your classmates, right? How, each of you like support one another. But there might be I'm just mentioning there might be some places that we're in it because it's still generally it could still be a predominantly male, class or like residency program, or even, faculty and all that. But I don't think we should see that as anything that we would need to shrink from. We just go in and blend in with them too. So I think as my colleagues here, Dr. Godfrey and Pramati, I think it's how we carry ourselves. Of course, there are things we understand. We're not going to be able to play football with them. They would, but it was very nice. I remember my co-residents, they invited all the women as well. At least they made it into a softball, something that's not as intense, but definitely made sure that the women were part of something as an activity. So I think that's something that we should just also assert ourselves in such a way that without having to be, like really make a big deal about it. But there might be some things of those sort of that can be felt. But I think we just have to be cognizant about it and how we manage them. We can manage them in a more positive way rather than to be competitive.
Thank you. Yes, it's a good point you made about not shying away from a program that does seem predominantly male, because I know personally, like looking at residency programs for the upcoming year, it can be kind of intimidating when it looks like for the past couple of years they've only accepted male residents, or that's just what their class came to be after the match. And so for me, it's like that moment of, well, one, will I fit in? Will I have people, my people, I find my people, or I don't want there to be some kind of bias that also kind of runs through my mind as well. So it is a good reminder to just, in medicine in general, women don't tend to be the dominant gender, but to not be afraid to still apply to those programs. Thank you. Okay, we'll move on. Dr. Godfrey, what are the areas that women who want to pursue leadership can improve on as compared to men?
Yeah, so that's a good question, and I spent some time thinking about it. And the interesting thing about medicine now is that the medical school classes are fairly balanced between male and female. But the higher you go up in the medical hierarchy, especially in like an academic center or in like a big medical center, there are fewer and fewer women. And so there's very few like chair of, department chairs who are women, for example. And I think there's a lot of reasons for that. And and some of it, like, we can't change. So it doesn't, we need to have, there needs to be some sort of systemic changes. Like, you as an individual can't just change the entire culture of medicine. But I think that seeking out mentorship is incredibly important. And they don't have to just be women mentors. They can, as I mentioned before, I've had male attendings when I was in training who were incredible mentors to me and really saw potential in me that I didn't see in myself. And that was very appreciated. So seeking out mentors and not counting yourself out of these leadership positions, thinking that it's going to be too time consuming, or, if you do have, a family or, parents or other people that you are caregiving for, thinking, how can I make this work in addition to my caregiving responsibilities? But don't count yourself out of these opportunities. And then, I didn't initially, go right out into practice, think that I was going to end up doing some of these leadership positions that I have. But I think being willing to, take the step forward when opportunities present yourself is really important as well. So when you see those opportunities, raise your hand and say, yes, I'd be happy to take that. And I think women have a lot of natural leadership skills. We tend to be really great community builders, and that works really nicely in PM&R because it's such a team-based field that I think we really have the opportunity to shine as leaders.
Thank you. And I think we have a question from the audience. Jennifer, would you like to unmute yourself and ask your question?
Hi, everyone. Thank you so much for doing this panel. I just had a quick question. Just in the realm of medicine, I think it's very common to run into patients that have experienced violence or trauma in their life, especially with traumatic brain injury and spine injury. Dr. Godfrey works at the VA. Dr. Karamani, you mentioned that patient with the sexual assault. Did you all each learn trauma-informed care on the go while you practice, or did you obtain resources elsewhere?
For me, it was more so kind of on the go. We work with a lot of neuropsychologists here. So I would, tap into that resource to help me out. And a lot of times I would refer the patient to them as well to help them along in their care. Just like Dr. Godfrey mentioned, we don't work in silos, we work as a team. So a lot of this trauma care did involve bringing a lot of other of my coworkers, the neuropsychologists, the physical therapists, and the speech therapists on board. And we have case managers as well. So the case managers can really help with finding. So we have a program called Dove at one of our sister hospitals, which is geared towards women who have had a history of domestic violence. They have legal guidance for those women as well. They have support groups. So having the case manager there to find these other like social supports for the patient is really key. So it was learning a lot of it just as I was going along, and learning it a lot from the other members of our team.
Yeah, I did not receive any formal education in that in medical school. I don't know if maybe it is part of more medical school curriculums now, which would be great, but I think it also was very much learning on the fly. And many of my patients, you have people who have, traumatic amputations with a brain injury and PTSD. And so it can be very complicated, but again, we don't just work in silos. We have, other people who are experts that we can call on to pull in. And I think that's really important.
Great question, Jennifer. Thank you. Okay, we can go on to the next question. This will be for Dr. D. Can you describe your role and experience as a mentor and or mentee? And do you have any tips on how to find and gain the most benefit from these professional relationships?
Yes, so I have been really blessed in my pediatric rehab, journey to have been able to have a mentor throughout residency who took me under her wings. So basically, we started out, this was just because that was the thing that I was seeking out. I'll mention her, Dr. Hik-Yong Kim. I don't know if some of you know her. She's really one of the premier pediatric physiatrists, and I've been blessed to be able to work with her. So I would really seek her out in terms of, let's say, so when I was in residency, I didn't really have an attending, that was really assigned to me because there was really no one. And I was kind of between residency programs. So as a 5-year program, it was separate really from pediatrics 2.5 years, and then PM&R 2.5 years. And I didn't really have anybody in our program who's designated the peds PM&R because there was no one above me for that, for that specific program itself. And so there was no one after me. So I was basically alone. But what I did was I sought her out and just asked her. I was like, hey, so I just started coming to her clinics whenever I could. Let's say I was in pediatric electives and stuff like that, then I would just arrange. So that constant, like really going out of my way, trying to really seek out, just to begin with, is to learn from her what is this is pediatric rehab, the thing for me. And with that, we got to learn more about one another. We got to know each other better, and that has become into a friendship. There's definitely still a mentorship going on, but over time we became colleagues after I graduated. But she was really very instrumental in terms of how I would navigate, especially in a field we're in, how do I finish from here? And she was basically, even though she was really not an attending for the Temple Einstein program, she was even outside of our program, but she was also kind enough to take me under her wings and even not just mentored me, but sponsored me. So that's the other thing I wanted to also put out there. As I've learned over time, it's not just about the mentorship, it's a sponsorship. A sponsor is basically also somebody who would, help us to kind of get in to the ring or get in a step further, who would advocate for us or who would help us, like, put us in some committees or something, put a good word in so that we could, get into whatever field we wanted to go into. So I realized she did not just mentor me, but she sponsored me as well. So that's one thing that I also keep in mind whenever I have a mentee. I try to really get to know what they want, what they really want and how they want it, so that it will match. Because first of all, I have to make sure, it's like, okay, how much do you want this? You have to show me, for example, like, okay, is this really your passion? I think there's, as a mentee, we have to really seek out, opportunities and be willing to go above and beyond just whatever our 8 to 5 time, and, be willing to do some of the, learning activities alongside with a mentor and not be afraid to ask questions. And then with that it also, it's both a learning, not just from a scholarly or educational activity, but learning the ways of how people do things as well. I felt like that I learned a lot on how did they, go about their day, or how did they structure, if they had this conflict or if we had this issue, how did they resolve it? So you kind of also, so looking at it as a whole picture, as one is kind of, as we are formulating our own kind of, like, how did I like the way that this person did something as opposed to, another person. So but yeah, I think there's a lot definitely as well with regards to mentor-mentee relationship. So there's one, just the typical, how you relate, and then the sponsor part. The one thing I'm trying to look into as well is coaching. As mentors, how do we also try to use, or that the principle or the concept of coaching our mentees? So I think, at that part, do we still call it mentorship? I don't know. So if you put it all together, it may not just be limited to mentorship. So that, I think that I'll stop there and see if, my colleagues also have other things that they wanted to add.
I don't know if I really have too much else to add. I think as a mentee, it's mostly just reaching out to my mentors and reaching out to them frequently to just kind of pick their brains and getting their thoughts on like X, Y, and Z. I feel fortunate that my PD when I was a resident was my mentor, and I mean, she's absolutely amazing. She was a PD for 20 years before I took over for her. And prior to being the PD this year, I was the associate PD under her. So I really got to pick her brain a lot, and mostly kind of learning like, how can you streamline your tasks? How can you try to make life easier for everybody involved, and trying to just find like the simplest solution is usually the best solution. But yeah, it kind of all the things that Dr. D kind of already mentioned. For us at our program, we just started a mentorship program where people, our attendings were assigned a resident. So we're trying that out. We do understand that it's not going to be a perfect match, but the pairing is encouraged to, see what the resident's interested in and maybe match them with other people in our greater Baltimore area community that would fit what they're interested in. So thankfully for the people that I'm mentoring, they are interested in TBI, which is kind of a perfect match with me. But, I know one of our other residents is a bit more interested in peds. We don't have any kind of peds attendings on our campus at Sinai, but, they were given contact information for the pediatric attendings that are more so affiliated with Hopkins. So they're going to be like in touch with them. I don't really do that much research. So for my mentees, I reached out to different researchers in the community and got them hooked up with one of them so they can join one of their research projects. So it's I think a lot of it is as a mentor trying to open up opportunities for my mentees, just kind of like what Dr. D was mentioning. Yeah.
Thank you.
I don't think I have anything to add. Those were great answers.
We do have a question from the audience. Clarissa, would you like to ask your question?
Yeah, thank you for having me. This kind of goes with Dr. D and how all of you are coaches and mentors in the Zoom session. So I was thinking about everything that we've talked about, and oftentimes when men are in a position of power, it's less questioned, but when a woman is in a position of power and they're delegating tasks, it's often deemed as, the negative connotation of like bossy. So like, I was just wondering how you respond to that, if that's ever happened in your career. And yeah, like if you let your work speak for itself or like respond vocally, or is it like on a case-by-case basis?
Yeah, it's a good question. So men and women are perceived differently with the same behaviors, right? And people of color might be perceived differently as well. So there's like added layers upon that. And so I think it can be tricky to navigate that dynamic sometimes. I do remember as a resident sometimes being perceived differently by nurses than my male colleagues, the male residents, when they would ask for things. And I think it's part of, you should do what feels natural to your personality. I don't think you should become a different person to do, so my personality tends to be, I want to build community and I want to be friends with people. And so if I was having a hard time with, interpersonal conflicts with a nurse who I felt like I wasn't, there was some tension there, then I would, go to that person and talk about it instead of just saying, you just have to do what I say. So, I think, lean into your natural strengths. And I think that we have a lot of strengths to offer. And so, I think lean into those, but it can be tricky. Absolutely. And I'll just add one last thing. The team that I'm like the leader of in our amputee rehab team, everybody else is men. So the physical therapists that are in our amputee rehab team are men. The prosthetists that I work with are men. And so I'm the only woman in the whole team, and I happen to be the leader, but we have a very collaborative environment. And I think we as women can often foster that type of environment where it's not top down, like I'm going to tell you what to do with this patient. We all get to weigh in on what is happening. And that's really how it should be in rehab. Everybody should weigh in from their perspectives.
Thank you. And thank you, Clarissa, for that question. That was a great question. Okay. For our next question for Dr. Karamati, what are the qualities of a strong applicant for residency, and what are some red flags on an application?
Sure, I'm sure this is on a lot of people's minds here. So as far as the qualities of a strong applicant, I'm sure it's going to be a bit different for each of us. Overall, we're looking at good academics, obviously having like good grades and good scores, which I think there's a question about that a little bit later on. And looking if you got good clinical skills, which is mostly looking at your rotations, how you do on rotations, and kind of like the comments that the rotators put for the students, which, I mean, looking through a bunch of them, the cycle and last cycle, like everyone's amazing. It's kind of everyone's coming in with great scores, with great evals from rotations. So everyone's in a pretty level playing field on that. So another thing I like to look at is other interests that the student might have, kind of bringing that in. So like looking at their CV and seeing if they've had experience as like a radio jockey, or like playing the guitar, or some other like creative thing that they've been doing, or some other volunteering stuff that they've done, just kind of seeing them as like a well-rounded person, and other kind of interests that they're also bringing. So I kind of like seeing that there, because it just kind of kind of shows the full person rather than like their medical school and kind of more rigid like application side, that they're kind of bringing these other aspects in. And because with physiatry, it's not just like learning algorithms, it's bringing an aspect of creativity sometimes into patient encounters, where we may be presented with a novel problem, and sometimes we need to kind of think outside the box. So sometimes just having other experiences outside of just like medical school and stuff like that can really make a great applicant. As far as red flags, kind of the biggest thing is it's kind of maybe more obvious. Failing is always going to be a red flag. Any gaps. But that doesn't mean that we're just going to ignore the application. I really do try to find explanations for any of those red flags in the application, and kind of see what the explanation is for some of those red flags.
Thank you.
If I may add to Dr. Karamati's comment, especially with gaps in training, or like that you think that people would question why. For example, you took a leave of absence from school or whatever. I would encourage you to write it out or explain it, so that whoever reviews the application doesn't have to assume, oh, I wonder what happened, or let's say, especially if you had trouble with the exams, you failed once and all that, it's okay that, there might be something that happened, or preparation was not there. So I think, as much as you can change what the truth is, you can word it in a more positive way, right? You can, we all have failures. This is what it is. That's life. And it's okay. It's just how we go about it, or what did we do to change or improve, or how did we face it? And so I think I would suggest if there might be something in your application that people might question, if you are able to go ahead and explain it or give a little bit more comment to it, that leaves less room for any possible negative assumptions.
That is a good tip. Thank you. Okay. All right, we'll go ahead and move on to the next question. This is for Dr. Godfrey. Do you have any tips for medical students on how to stand out on both away rotations and interviews?
That is a great question. I'll start with away rotations. So I think they're such a great opportunity for you to get a feel for the culture of the place that you're rotating, and if this is somewhere that you want to spend multiple years of your life training. So remember that you're evaluating them as well. It's not just them evaluating you. Tips to stand out. You know, I think the students who we get quite a lot of visiting students that come and rotate with us. So the ones that stand out are often the ones who really ask to sit down with me and say, hey, can we sit down after clinic today? And I ask you some questions. And they'll just ask questions about patients that we saw, you know, throughout the afternoon or the day. Or they'll just ask about the field in general. And I think that shows a lot of just initiative. I think also saying, you know, as a student, can I take on this patient? Can I see this patient? Is great and shows a lot of initiative as well, instead of just sort of hanging back. There are some people who do sort of tend to hang back in the background. And I know that can be tough when you're in a new situation, but showing that initiative and interest can be really important. You know, if you have the opportunity to give a presentation, take that. That shows a lot of initiative as well. If they say, hey, you know, we have a noon conference and you take the chance to give a presentation, I think that's wonderful. And also remember that the residents, we, at least in when we're interviewing people and considering our rank list, we ask our residents, what did you think about the medical student? Because oftentimes they will see the medical student in times when the student isn't like on, you know, for me. And so I think that's also really important, is make sure that you are working well with the residents, being respectful to all the staff. There have been times when we've had visiting students who have rotated with us and they've been rude to staff members in the hospital, like the housekeepers. And we're like, no, we don't want you to, you're out. Like, we're not going to match you. So I think things like that, like those are really important values to our program, that, you know, everyone gets treated with respect. And so make sure that you are, you know, constantly on your best behavior and taking the opportunity to talk to the residents and get to know them as well. So don't count out the residents. And then the other one was how to stand out in interviews. You know, one of the things, by the time, at least for our program, by the time you get invited for an interview, you're really the cream of the crop, because we get so many applications. And so everybody who comes for an interview is really excellent in terms of like their scores and their research and their volunteerism and all of that. So at that point, we're really looking for, are they able to communicate? Are they able to express their interest in the field appropriately? That type of thing. So for me, if I see a lot of passion for the field, that really stands out to me. And I think that can be true for a lot of people in PM&R. We want residents who are excited to learn and are excited about the field. And I would also caution, if an applicant is too laser focused on one part of the field, that can be, I think, a detriment. At least in our program, it can be. If someone is only talking about one aspect of the field, we really do worry that they're going to be unhappy training the other, you know, in every other rotation that they do in residency. So we want to get residents who are, I mean, you may end up specializing, that's perfectly fine. But we want people who are going to be interested and engaged in everything they do in residency, because really, I think every experience you have in residency makes you a better physiatrist in the future.
Thank you. All righty, looks like we'll have time for maybe one or two more questions. I'll go on with the next question. Dr. D, if in-person interviews are permitted next cycle, will you consider keeping virtual interviews as an option for applicants? And do you think that there would be a disadvantage for applicants if they interview virtually versus in person?
It is an ongoing discussion, at least even within. So there's a couple of layers here, especially we're part of an institution from a mandate standpoint, right? If, of course, for example, the whole Baylor says, no, we're all doing virtual, then it is, that's what it is. If they open it up to in-person versus virtual, I mean, the next layer is also, I'm actually looking forward to what the discussion would be at AAP, depending on how we play it, right? Because I think for me, it doesn't matter. I'm also open to actually even keeping it virtually as long as it's uniform. It's to make it an even playing field to whoever is applying to our program. So that's where we even had to, decide if we, especially with this past recruitment season, do we allow for an in-person visit, aside from the virtual. We said, that would just make it, very awkward and, would send mixed signals. Even though people would like to visit, but some people may not have been able to visit with that influence or bias, the rank list in whichever way. Because even our virtual second look, we did that after we completed the rank order. So what I'm trying to say is, yeah, it doesn't matter which direction we go. But as I said, I wanted to make sure we're looking at it from a bigger picture. But the most important thing for me is just making sure that it's an even playing field, and there's no question about biases and all that stuff. So
Thank
just to answer the question, we have not decided whether or not we're going to do all virtual or in person.
I'm excited to hear what everyone decides. I think there's definitely pros and cons to both. So excited for this upcoming year and to see what's going to happen. Thank you. So we'll go through one last of the submitted questions. A lot of you had submitted this question, so I know you're curious. For Dr. Karamati, now that step one is pass-fail, how do residency programs plan to navigate the change and evaluate each applicant without a score?
So yeah, I'm curious to hear what the other PDs say as well. I know that's going to be really tricky. Obviously, we're going to be looking at other parts of the application. I'm planning on looking more at what's called the MSPE, which is kind of submitted by the medical school. It's the medical students performance evaluation, which has just kind of like the overall scores, and kind of like how you did on rotations and kind of like the comments on the rotations. So the information that we've already had. Yeah, and I know us as a field have decided to opt into the ARIS supplemental app. I believe this is voluntary for programs and students to participate, but I believe it allows students to preference signal. I don't know if we've completely decided on how many. I think last time I heard it was 4. I don't know if that has changed, but I think that would be really helpful to kind of get an idea of, what you all are wanting, and just having that extra piece. So it's still in like a trial run mode, so it's not mandatory by any means. So yeah, I will pass it on to other PDs to see what their thoughts are as well.
If I may, I can share what we have been doing in the past 2 years, especially with the virtual. So we kind of revamped the way that we are screening, so-called, so to speak. So now we really ask, we have a recruitment committee, basically. So we will review all the applications, all 500 applications the same way. Yeah, because as I said, if I were to do it along with my APDs, we will not be able to do this. And so we basically shared the load with the rest of our faculty as well. But we made them do some trainings. So we created rubrics So how each application would be scored according to categories or I guess pillars, so to speak, if you whatever you would call it, and so that we don't filter anymore by score. This is in preparation, knowing that we won't have, a USMLE step 1 score anymore. So the step 1, and then we put a weight to each. So for example, life experiences, we would have a criteria from a range from 1 to 4 for each of the rubric. And then we would put in like, what are the things that you would see in an application, and then score a person accordingly. And then each of those categories would have their weights. We are not necessarily too big on the academics. I mean, it's not as, we put in more on life experiences. Research is also a part of it, but it's not like huge. It is an ideal, it's an extra point, but it's not necessarily going to be a deal breaker in a way. So that's what makes us help kind of put together the application packet. So we're kind of still, even, as we go through each year, we're kind of, adjusting here and there as well. But that's one thing that we've tried to we've gone into, and we hope to really continue to do that and improve it. So we're actually, as a plug, they said, one of our APDs and one of our residents worked on this, and they submitted a poster at AAP about this. And also there's a manuscript on this that's I think in press for the AJPMNR about what we did.
Thank you. Yeah, I can't wait to read that manuscript and see what they come up with and talk about. All right, I do see a question. Let's see, who was it that raised their hand?
Elise.
Elise, yes, if you'd like to go ahead and ask your question.
Yes, thank you. I had a question about how each of your programs interact with the community that you're located in, and if you had some good examples of that.
All right, I guess I'll start. I think each of the attendings just have different interests, so they will engage in community in their own way. I see a good amount of MS patients, so I'm a little bit maybe more involved in the MS Society. I volunteered for the MS Society for Pass Walks in the past years, and this year we ended up having a cyanide crew, so I was actually able to be there as a participant, helping out our own MS patients, which was kind of weird for me. So I'm so used to doing more of the volunteering side. But other attendings are going to have different interests and engage in different ways in the community. Some are more like MSK sports, so they might volunteer for like runs and stuff when they finally did restart, because they weren't doing them for quite a while for COVID. With being more in the TBI world, we're also pretty engaged in the the Brain Injury Association of Maryland. So we do have a couple people on staff, like psychologists and case managers that are actually part of the Brain Injury Association of Maryland. So we kind of engage a little bit more with that. Yeah, that's what I can think of more in I guess my realm in the area of Baltimore. But I'm sure if I ask each of the attendings, they'll have different responses of how they're engaged in the community here.
Yeah, I would say very similar with our program, engaging in, like the Brain Injury Association, the ALS organizations, Amputee Coalition. I think a lot of people are involved with that, and our residents get involved. Definitely like race coverage, sports coverage. Sports coverage of the university. Our residents are involved in that, so engaging in the university community as well. So yeah, quite a bit of that.
Yeah, for us in Houston, we have what we call Rehabilitation Services Volunteer Program. It had to be kind of put on hold. This is a clinic and an equipment kind of service to the community for the for the indigent population or the non-insured people in the Houston area. And so this was something that some of the residents were welcome to volunteer at. There's the wheelchair kind of fitting and donation part, or other rehab equipments, and then there's the clinical part as well, wherein we have some attendings who would volunteer their time for this clinic to see some of the patients, like stroke patients, or sometimes they would even do botulinum toxin injections, like donated as samples. And then as at Texas Children's, we also are very much involved with the Easter Seals of Houston, because in pediatric rehab. So I'm on the board of directors as well. So as with each other attendings also would have their own same thing with marathon runs and sports coverage. And so there's opportunities definitely for residents to join in whatever time they have. So we just offer them, and they usually just seek out, or once they learn about it, whenever they have time, they would just reach out and let the attending know. So for the Easter Seals, we have CP camps. So I've offered it to residents. So far, it's basically those who are interested in pediatric rehab who would come and join us and volunteer. So.
Awesome. Thank you so much.
Thank you, Elise, for that question. Okay, so we're at 8 o'clock, so we'll close this up pretty quickly so everyone can get to sleep. But I would like to ask and hear from a couple of the attendees on the call on what you thought the most interesting part or point of tonight's discussion was. Just some quick points about what you really enjoyed.
I can go first. I think something that really changed my thinking about mentorship is something that was highlighted by Dr. D about the difference between mentorship and sponsorship, and going forward, what that will look like in residency and beyond. So thank you so much for offering that.
Thank you, Tricia. Would anybody else like to talk about what they found interesting tonight?
I want to add something as well. Thank you all so much for being here, for presenting to us. And something that really stood out to me was when Dr. Godfrey, when you were saying that you being the leader of an all-male team, inherently made a more collaborative, environment. I just thought that was an exciting plus to think about with having women in leadership, is how we do lead. We may, because we're women or just because we're all unique people, lead our teams differently, and how that can even enhance the efficacy of our teams, and how well we communicate with each other because of the environment that we create for our team. So thank you.
Thank you. All right, guys. So to let everybody go, I would like to ask one last closing remark from the panelists. If they could just please share just one short key piece of advice for women in medicine. We'll go alphabetical order. So if Dr. D, if you would like to start.
One key piece for women in medicine? Is that
Yeah, one key piece of advice.
I think really just follow your heart. It doesn't matter, as I said, by gender, role that we play, as long as you enjoy what you do. Because I think this is where your passion will fuel you. It doesn't matter, academic medicine, private practice, wherever you go. Follow your heart. And also, for me, whatever also fuels it, for me, it's my faith that helped guide me along the way as well. So whatever it is that you believe in, go for it, and give your best, and be present. Be willing to do whatever is needed, and that enhances your learning as well. So whichever direction that you go, so be willing and be present.
Thank you. Dr. Godfrey, would you like to share your advice?
Yeah, I will. Since I know this was something that I was always interested in, I'll talk about motherhood and medicine a little bit more. Because I always wanted to know from people, how do you do it? How do you balance it? So for those of you who may end up having children someday, or maybe have some now, First, I would say just try and ditch the guilt. Ditch the guilt. It's not going to serve you. You can be a wonderful mother and a wonderful physician at the same time. And also, the time in your life when you are raising children is not your whole career, right? So there might be a period of time in your life when you have young children and that may be stressful and there's a lot going on, but like kids grow up and at some point they leave your home and you have a whole career left. And so I would say, don't downsize your career too much to the point, maybe you are trying to be flexible for your family, but don't give up something that you love in your career that you won't be able to get back later. I guess would be one of my suggestions is just be aware that the season when you have children is just part of your life, and it can be a very intense part of your life, but it will not be your whole life. And you will have time in the future to do other things as well and think and put your passions elsewhere. So you can do many things, just maybe not all at the exact same time.
Thank you. All right, Dr. Karamati.
All right, I guess I'll end. I'll try to keep this nice and short. So I know as women, we're usually raised to be kind of quiet and dainty and kind of be in the corner. I would say, don't be afraid to speak up and state your mind. Say it loud and clearly so everyone can hear. Go forward with confidence.
Thank you. Those are all wonderful. I will definitely keep them with me as I go through this year and go through just the rest of my career. And thank you all for joining us. I'd just like to express again my sincerest gratitude to Dr. Godfrey, Dr. D, and Dr. Karamati for putting aside this time this evening to have this discussion on a very important topic. I really appreciate you joining us, and I hope you all have a wonderful evening.
Thank you so much.
Thank you so much for having us. It's an honor.
Yeah, thank you so much.
Yeah, this has been really fun. It's been a pleasure.
Good luck to all of you.
Thank
Yes.
you.
Good luck. Maybe we'll see you on the interview trail.
Fingers crossed.
Take care.